So it's an honor and privilege to introduce Dr. Bourla, and I would suggest to you that it's a rare treat to be able to introduce a true hero. Dr. Bourla leads Pfizer in its purpose, breakthroughs that change patients' lives, with a focus on driving the scientific and commercial innovation needed to have a transformational impact on healthcare. He's only been CEO since 2019 and chairman since January 2020, and he's had to lead the company and the country through its most difficult healthcare crisis in a century, and he's done that amazingly. He's had a diverse and successful career at Pfizer, which has informed his understanding of the needs of patients and deepened his commitment to helping ensure equitable access to medicines and vaccines. He's a doctor of veterinary medicine and an accomplished researcher in his own right, and has been awarded a number of honors. He's about to receive the 2022 Genesis Prize in recognition of his leadership during the pandemic. In 2021, he was named CEO of the Year by CNN Business and inducted into the Crain's New York Business Hall of Fame. He's on the executive committee of the Partnership for New York, a vice president of the International Federation of Pharmaceutical Manufacturers, and a member of multiple boards. He's also a member of the Council on Foreign Relations and a number of other committees. He's also got an amazing personal story, which he'll tell you about. His family having barely survived the Holocaust, coming to the United States, and built the incredible career that you've heard about and will hear about. I don't think any of us can express enough gratitude to Dr. Bourla, both for what he's accomplished and for being here today. Dr. Bourla, please join us for your address.
Thank you. Thank you, Dr. Cadiz, for that kind introduction. I want, of course, to thank the trustees, the faculty, the New York Medical College for inviting me here to deliver today's commencement address. And, of course, congratulations for what a wonderful achievement of 4 years hard work. I'm thrilled that we can be here in person today. I had the opportunity to deliver 2 commencement speeches last year. All were digital. And we know that graduations are so much more enjoyable, more meaningful when we can feel the presence of the people that taught us and the people that together we work hard to gain this well-deserved degree. As a proud Jew myself, I'm thrilled to be speaking at a school that is part of the Touro University system, one of the largest Jewish educational institutions in the United States. Now, hailing from Greece myself, the birthplace of modern medicine, I'm always heartened to be in the presence of those who represent the future of healthcare, you. If you are anything like I was at my graduation, as exciting as the moment is, I'm sure you're also feeling a little bit nervous about what comes next. That's because every graduating class enters a world filled with both great promises, but also great challenges. And you, my friends, are no different. Now, the exciting thing about your new chapter is that there is no curriculum. The entire thing is an elective. Your choices will define your future going forward. And we live in a time that choices make a difference. Science is increasingly demonstrating the ability to take on the world's most devastating diseases. And as we continue to build upon our innovation ecosystem, we expect a dramatic impact on human health and disease, where we can hopefully cure many incurable conditions, transform others into manageable chronic conditions, and be prepared for the next pandemic, if it comes. At the same time, the convergence of several global events is putting great pressure on global health. COVID-19 has caused catastrophic loss of life and pushed healthcare systems to their limits. The war in Ukraine also has led to a tragic loss of life, while spawning a refugee crisis across Europe and other parts of the world. And climate change has the potential to impact public health in a myriad of ways, including increasing the risk of vector-borne and water-related illnesses. These challenges may seem insurmountable, but if I have learned anything during the past 2 years, is that nothing is impossible. 2 years ago, as COVID-19 was spreading across the globe, the New York City was at its epicenter, in fact. Pfizer, we challenged ourselves, I challenged my team to develop a vaccine and get it in the hands of patients in less than a year, instead of the 8 to 10 years it usually takes. Understanding the urgency of the moment, my team came to me with an incredibly ambitious plan that would have shattered all previous vaccine development timeline records. They said that they could have a vaccine in 15 months. But I felt that still that wasn't enough, because the fall was not in 15 months, it was in 8. I asked them to think about how many more people would get sick or die if we didn't deliver by the fall. Many of them thought what I was asking for was unreasonable. And most, they thought that it is impossible. But they went back to the drawing board. They pushed themselves outside their comfort level, outside their comfort zone, and eventually advanced our science more quickly than they had ever imagined they could. They delivered a plan that would deliver a vaccine in 8 months. And they did it. And developing the vaccine was just the first step. The challenge was repeated, because we had simultaneously had to be able to produce enough doses for everyone in the planet. The previous year of the pandemic, Pfizer was manufacturing approximately 200 million doses of all our vaccines across all our manufacturing sites in the world. What I asked the team to do was not to make 300 million doses of the new vaccine. That by itself would have been incredibly difficult, but would force everyone to think how they can improve the new processes, the current processes, rather than being able to deliver something completely new. I didn't ask them to deliver 300 million doses. I asked them to deliver 3 billion doses in the first year of manufacturing of this vaccine. And they did it. By the end of 2021, we had produced 3 billion doses of vaccines that were distributed to 179 countries across the world. Already, we are in a position right now to cover all the needs of the world, as much as that can be. But of course, the third step, which was getting the vaccines to patients everywhere around the world, has proven to be the most challenging one. Unfortunately, there exists a tremendous health equity gap in our world that determines which of us can have access to the latest medical innovations and which of us cannot. Right now, we have hundreds of millions of doses of vaccines that are donating from the US government or the European Union for free. And unfortunately, the vaccination rates in developing countries are very low, because supply is only one component of this gap inequity. the lack of infrastructure, the lack of people that will diagnose the diseases, the lack of people that will deliver the vaccines. Medical centers, vaccination centers, are driving vaccinations very, very, very low right now. With all we have learned and accomplished over the past 2 years, we really need to do something to close this equity gap. You just mentioned, President, that I had the great honor to come back from Davos yesterday. But the honor was that I served the stage at the World Economic Forum with the presidents of Rwanda and the presidents of Malawi, as well as Bill Gates, to launch an accord for a healthier world. According to this groundbreaking initiative that we launched yesterday, Pfizer commits to provide all of our patented medicines or vaccines that are currently available in the US or in Europe on a non-for-profit basis at cost to 1.2 billion people living in the 45 poorest countries of the world, among them Rwanda and Malawi. And we made the commitment that as we discover new medicines, they will automatically find their way to this list that will be provided to these countries at cost. The decision to launch such an accord was an easy one because it was guided by our purpose: breakthroughs that change patients' lives. And the recognition that our breakthroughs won't do anyone any good if people can't get access to them. I was surprised when many people on interviews, they asked me, how do you think your shareholders will feel that you are giving at no profit to a very large part of the population these vaccines? And I said that if I was a shareholder, I would like to invest in a company that is doing the right thing. And this is, I think, how our shareholders will feel. As physicians yourself, you understand better than most of all professions the power of purpose. It was purpose that filled you with excitement and I'm sure a little anxiety at your white coat ceremony. It was purpose that fueled you through long nights and kept you from quitting during those times that got a bit overwhelming. And it is purpose that has you looking to the future with a great sense of hope that you can make a difference in this world. As graduates of this great institution, you stand on the shoulders of many purpose-driven professors, researchers, and students who have come before you. Barrier breakers like Sophie Rabinov, former professor and director of the college's Department of Public Health and Industrial Medicine, who became the only female physician in the first group of American Zionist medical unit that created the first clinic in the British, at that time, occupied Palestine for Jewish and Arab students. Innovators like Edwin Kelburn, former faculty member of the Department of Microbiology and Immunology, who developed more than 50 years ago a method for producing high-yielding recombinant influenza vaccine strains, a method that is still used today, 50 years later. And visionaries like William Campbell, former adjunct faculty member of the same Department of Microbiology and Immunology, who discovered, along with his partner Satoshi Omura, a drug that treats parasitic diseases such as river blindness. This breakthrough earned the two of them the 2015 Nobel Prize in Medicine or Physiology. While I don't know any of these innovators personally, I would bet that one thing they had in common was a clear understanding of their purpose in life. Each of you were fortunate to have found a school that allowed you to thrive in pursuit of your purpose. Now the world needs you turn your purpose into action. The accelerating pace of innovation is a cause for great hope because it will result in improved health outcomes. And each of you Whether you become a surgeon, a primary care physician, a researcher, a teacher, or a clinician, you will be on the front lines with an opportunity to have a significant impact on human lives, on patients and their families. At Pfizer, we refer to the development of our COVID-19 vaccine as a moonshot, a term that has become shorthand for reaching big, for pursuing aspirational and difficult ventures. Today, I would challenge each of you to pursue your own moonshot, to ask yourself how you can achieve something that no one else has done before, to find out how far you can push the limits of science to have the most meaningful impact on patients, to create something truly transformational, either for global health or for an individual patient that may be in your care. This is how science continues to advance, how medicine continues to win the battle against disease, and how you will leave your mark on the world. I will close with words of wisdom from perhaps the greatest philosopher of all time, the namesake of the university from which I proudly graduated, the Aristotle University. Aristotle said 2,300 years ago, our problem is not that we aim too high and miss. Our problem is that we aim too low and hit. I encourage each one of you to aim high, higher than you can ever imagine. And if at first you miss, don't lower the target. Keep aiming high, because when you hit, the reward will be great for you and for the people that are dependent on you. Thank you again for letting me be part of this wonderful celebration in this wonderful moment of your life. The end of what you think it is a challenging chapter, but the reality it is the easiest part of life. Congratulations, good luck, and thank you in advance for the tremendous good you will do for the world. Enjoy the rest of the ceremony and good luck. Congratulations.